This is an x-ray of a 13-year-old patient who presented to my office with acute lower back pain and radicular symptomatology into his right lower extremity along the S1 dermatome all the way to his foot. Onset of pain was insidious 4 weeks earlier with unremitting symptoms. He denied any bladder, bowel, or weakness issues. He denied any trauma or recent illnesses. On examination, he was quite painful on ranges of motion, and straight leg raise was positive on that side. I decided to send him to the radiologist, and these x-rays were performed. Radiologist called me and said, we have a problem. That L3 superior end plate looks suspicious, possibly a spondylodiscitis. I would recommend MRI with and without contrast. I agreed, and the patient underwent MRI. This is the MRI of our 13-year-old elite baseball player. And on the left, we can appreciate the T1 weighted image. On the right, we can appreciate the T2 weighted image. And what really jumps out immediately is the edema within the pedicle, superior articular process, and the inferior articular process, as well as periarticular edema in that region that could easily account for the patient's symptoms. Now, when we look at that superior end plate at L3 that was of concern and caused us to have an MRI performed, we can see some irregularity of that end plate, and it's likely a post-traumatic Schmorl's node or earlier event that led to some degenerative change. The radiologist was concerned and said that this is likely a stress fracture through the pars, and as a result, we referred the patient to an orthopedist who concurred. The patient was advised to stop playing baseball for 4 to 6 weeks, wore a belt, and progressively improved over time. If this case was of interest to you, please go to PostGradDC.com for advanced continuing education.